Let's get started with the ultrasound demonstration on fetal neurosonography. The fetus is at 27 weeks of gestation, and this is the transabdominal sonography. The most familiar image is the image for measurement of BPD. However, you can see the horizontal cutting section of the cerebellum nicely. You can see the fourth ventricle and bilateral cerebellar hemispheres and the vermis like this. Next, let's get started with the transvaginal neurosonography. First of all, before looking at the fetal brain, you have to make sure that the cervix is okay. Now you can look at the fetal brain. This is the sagittal section of the fetal brain. The corpus callosum and the mid-sagittal structure is visible. But now you are looking at the brain from the sagittal suture here. However, the anterior fontanelle, the widest ultrasound window, is here. Of course, you want to observe the fetal brain via the widest window, don't you? So I use my left hand, tap on the fetal head or push it and move the fetal head so that I can do anterior fontanelle scan. Then I rotate the probe 90 degrees and you can see the coronal section. You can see from frontal to occipital region of the brain by moving the probe. Then 3D. Put the ROI, and this is the fun scan of 3D acquisition, and immediately after the acquisition you can get the 3D three orthogonal view. If you scan from here using the sagittal suture as an ultrasound window and take 3D acquisition, you can get just the image like this. As shown here, the brain structure is not visualized well because the acoustic shadow due to the cranial bone. But good thing of scanning from posterior part, I mean the scan via the posterior fontanelle, you can see nicely the cerebellum and the brain stem as shown here in the mid-sagittal section. Now, once you get 3D acquisition via the anterior fontanelle, you can see the midrise structure of the corpus callosum and the cerebellar vermis and the fourth ventricle, and observe the brain structure in detail in continuous parallel section of sagittal plane. The left to right sagittal sections of planes, and switch to the plane A, the coronal section, the occipital to frontal, frontal to occipital, continuous parallel sections of coronal section to make sure the bilateral ventricles, choroid plexus, and sylvian fissures and other structure. Going to the front edge of the brain, and then you can see the bilateral eyeballs here, and then going back to the anterior coronal section. Please note that this is at 27 weeks of gestation, and sylvian fissure is much profounder than perpendicular at 25 weeks of gestation. You can get the quite clear bilateral lateral ventricles also in axial section, and it is possible to measure bilateral atrial width precisely. Actually, it is difficult to get a clear image of bilateral ventricles by transabdominal axial scanning because of the acoustic shadow. So it is quite helpful to observe the brain via the anterior fontanelle. Now let's look at the ultrasound window itself. By using the skeletal mode or maximum mode, you can see the bony structure of the skull. Here you can see the anterior fontanelle. Now let's magnify the image. You can see the frontal suture, coronal sutures, and the sagittal suture are well visualized. And anterior fontanelle is quite wide. Therefore, it is reasonable to use it for visualizing the intercranial structure. But what about the ultrasound window in the image where the acoustic shadow due to the cranial bone made it difficult to see the brain, as I've shown earlier? You cannot recognize the anterior fontanelle. Instead, this is the sagittal suture, which is not wide like the anterior fontanelle. Therefore, the acoustic shadow makes most of the brain structure be hidden and become black. Finally, if transabdominal ultrasound is the only option, or if there are conditions that preclude transvaginal ultrasound, such as breech or transverse fetus or myoma, try to perform the transabdominal neuroimaging via the anterior fontanelle. In this case, it seems to be impossible to scan via the anterior fontanelle because the anterior fontanelle is here on the top of the head. In this case, I use my left hand with my right hand with transducer, push up and float the fetal head, creating the amniotic cavity over the top of the fetal head. Now you can see the amniotic cavity here, and now the fetus is in oblique transverse position. So I can immediately do the neurosonographic scan. Here you can see this is the mid-sagittal section. That you can see the corpus callosum, cerebral vermis, and fourth ventricle. And then 90 degrees rotation of the transducer, you can see the coronal section of the brain, observing from the frontal to occipital structure by moving the transducer. Of course, you can try 3D neurosonography by transabdominal ultrasound. Now 3D acquisition, and then the observation of the brain on the 3 orthogonal view. Of course, it is sometimes challenging to perform neurosonography via the anterior fontanelle by transabdominal ultrasound, but please try it from tomorrow. Now you can see the sagittal, coronal, and axial section on the 3 orthogonal view, and easy to observe the brain in tomographic ultrasound imaging. So, take-home message from today's ultrasound demo is that the most important thing is the anterior fontanelle scan because it is the widest scan window. Thank you very much.